Beatrice, the chiropractor from Essential Chiropractic and Physiotherapy Center. I'm going to talk about slip disc condition today. Let's start with our spinal column. Our spinal column consists of a series of vertebral bones stacked onto each other, and each bone are cushioned by discs. Each disc has two parts, a soft inner layer, the nucleus pulposus, and a tough outer ring, the annulus fibrosus. The discs are kind of like jelly donuts, which they have a soft inner layer and a tough exteriors. The discs protect the joint by absorbing the shock from our daily activities such as walking, lifting, and running. However, physical injury or wear and tear can cause the inner layer of the disc to push against the outer ring. If the pressure continues, the inner layer of the disc will push all the way through the outer ring, causing the ring to bulge. This is what we know as slip disc or herniated disc. If the disc herniation is large enough, it will compress on one of our spinal nerve, where you will experience pain and numbness along the affected area. A slip disc can cause a lot of pain or no symptoms at all. Whether or not you have symptoms depends on if the disc is compressing on the spinal nerve. The more the disc compresses the spinal nerve, the more intense your symptoms may become. If the disc herniation is in your lower back, you may have intense pain, numbness, weakness, and also tingling sensation down until your butt area, your thigh, your calf, or even your feet. This is what we know as the sciatica, where you will have the intense pain and numbness in your lower back, down until your thigh and into one of your legs. If the disc herniation is in your neck area, shoulder pain and arm numbness may be one of the signals. It may happen in your mid-back area as well. So you will have the pain and tingling sensation from your upper back down until your lower back into your arms and legs. No matter where you are experiencing pain from a slip disc, it can feel like it's shooting into one of your extremities, especially when you cough or sneeze, or when you shift your body into a certain position or make sudden movement. Certain movements such as twisting and turning to lift an object can cause a slip disc. If you lift a very heavy, large object, it can place a great strain on your lower back. And if you have a very physically demanding job that requires a lot of turning, bending forward, and lifting, you are at an increased risk of having slip disc. Overweight individuals also at a greater risk for having slip disc because the disc have to support additional weights. Weak muscles and an inactive lifestyle also have a great risk of developing slip disc. As you get older, you are more likely to experience a slip disc. This is because the discs begin to lose some of their protective content as you age. This makes them more likely to slip out of the place. It may not be possible to prevent slip disc, but you can take some steps to reduce the risk of developing a slip disc. For example, if you are lifting an object, you have to bend and lift using your knees and legs but not from your waist. And do not remain seated for a long period when you're in office. Do get up and stretch periodically every 1 hour. Also, maintain a healthy weight and do some exercise to strengthen your core, your back and your legs muscle. There's no best treatment for slip disc condition, but the misconception that slip disc automatically requires surgery keeps some people away from seeking help when they need it. Most of the people with slip disc respond well with chiropractic treatment. A chiropractor will help you to address your back problem and your slip disc symptoms. We will also recommend therapeutic exercises to help you to strengthen your back while reducing your pain. Chiropractors evaluate the entire spine. Even if you only have lower back pain, we will evaluate your neck as well. We want to see how well your spine is functioning overall. And what happens in one area of the spine may affect another part of the body as well. Some patients are not a good candidate for chiropractic care treatment. For example, if you are having cauda equina syndrome, in which a condition where you lose control of your bladder or bowel with an intervertebral disc injury, you must seek immediate medical care because this is something that cannot be treated by a chiropractor. However, just like I mentioned before, most people with slip disc condition respond well to chiropractic treatment. We will develop a treatment plan that includes spinal adjustment to help you to ease your slip disc symptoms. The specifics of what are in your treatment plan are particular to your pain, level of activity, and overall health. In conclusion, chiropractic treatment is safe and effective for most people with slip disc. Patients that comes into my clinic with a slip disc rarely don't feel pain at all. Most of them present with a mild soreness or muscle strain, which might be the pain signal from disc bulging, which may lead to slip disc. This varies among individuals depending on their overall health and their age. So if you are only experiencing mild soreness, it's advisable to do a spinal checkup because it might be the signal from slip disc problem. Get in touch with us if you are experiencing any of the symptoms above. We are providing a free spinal screening, and I'm more than happy to help you through your recovering journey. I'm Dr. Beatrice from Essential Chiropractic and Physiotherapy Center.